Good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your day. We're just a few moments away from hearing about a new mental health center that will be opening up here in Jefferson County. It appears that members of the Jefferson County Sheriff's Office have approached the podium, so we will send you there live now.
In the Jefferson County Sheriff's Office. This is a great day today. We're thankful to Governor Ivey for selecting Jefferson County for this new mental health crisis center. And we have a lot of people to thank. It took a lot of people to get us to this point over a lot of years. So we're very thankful that this new center will be here in Jefferson County. We know this is going to help a lot of families, a lot of people, a lot of law enforcement agencies, a lot of courts, a lot of police departments. So this is a very good day. Today, you will hear from Jefferson County Sheriff Mark Petway, followed by Mr. Jim Crago of the Jefferson Blount St. Clair Mental Health Authority, followed by Vice President Ms. Susan Beatty Pierce of NAMI, and our own beloved Senator Jabo Wagner. After everyone has spoken, then you will have the opportunity to answer questions. Questions will be answered of Mr. Jim Crago and our Executive Assistant, Mr. Wayne Rogers. At this time, Jefferson County Sheriff Mark Petway.
Thank you, Chief AG, for that introduction. I'm Sheriff Mark Petway, and I would like to thank everyone for being here today to rejoice with us over some wonderful news that we received yesterday morning. As most of you know by now, the Alabama Department of Mental Health announced yesterday that this is the 4th Crisis Diversion Center will be built right here in Jefferson County. This center has been a long time coming, and as many of the folks here in this room could testify, and to now, thanks to a lot of the hard work by many of those same folk, it will be becoming reality this time next spring. In a few minutes, you will hear from Mr. Jim Crago, the Executive Director of Jefferson County Blount St. Clair Mental Health Authority. Mr. Crago can answer a lot of the more technical questions about the center, but I want to first give a few details about how the center will benefit law enforcement here in Jefferson County and beyond. Then I want to acknowledge a few members of the good people who have brought the project to this point. When my administration took office in January 2019, I pledged that we would work hard to ensure that mental health care improve both here in the jail and throughout Jefferson County. We took a major step toward improving mental health care at the jail when we brought in NAF Care as the health care provider for the jail, and last year insisted that they will bring out additional mental health nursing care and additional counselors. The Crisis Diversion Center is the next step in the process of fulfilling the promise to improve mental health care throughout the county. This center will give our deputies and law enforcement personnel the opportunity to take an individual in a mental health or addiction crisis into health care facilities rather than to the jail. The center will have the additional benefit of getting the law enforcement personnel back on patrol much faster. The center typically will average 15 to 20 minutes of officer time as opposed to 2 hours at the jail on several more hours at emergency rooms. The center will allow those with mental health to get access to treatment for faster. They can provide it once they have been brought to the jail and become a part of the criminal justice system. JBS hopes to have the center up and running by April of 2022. Prior to that time, we plan to provide extensive crisis intervention training to many of our patrol deputies so that they will be able to identify individuals who should be brought to the center. We also plan to offer that training to other law enforcement agencies throughout Jefferson County and beyond. In addition, part of the grant will be used to equip our patrol cars with telehealth equipment so our deputies can consult with mental health professionals at the center before making an arrest. I will let Mr. Crago address additional details about the center, but now I would like to thank a number of members on the board, and to ensure that our area will receive the grant to build the crisis center. I want to start with Mr. Crago and his staff from JBS, especially Melissa Gallagher and Megan Burke. JBS did the heavy lifting and drafting on the proposal that won this bid, and they will be responsible for running the center once it is built. They also assembled an executive committee drawn from across the community. The folk who served on this committee have spent many hours over the past year planning for the center and discussing the bid. The members of this committee are Brandon Johnson, Director of Community Engagement for the City of Birmingham, Dr. James Meador Woodworth, Chairman of the Department of Psychiatry at UAB, Mr. Tony Patelis, County Manager for Jefferson County, who's recently retired, Chris Rattan, Executive Director of the Alethea House, our own Mr. Wayne Rogers, who is my Executive Assistant, Susan Salin, President of NAMI. Susan is not with us today. She is out. She's on a trip, but we want to recognize Susan. Judge Stephen Wallace, presiding judge of the Mental Health Court here in Jefferson County. Kim Wigley, Director of Behavioral Health for St. Vincent's East. We also want to thank a number of the individuals who provided support to us through the process, including the Jefferson County Commission, the Blount County Commission, and the St. Clair County Commission, all of which provided important letters of support to the bid. I also want to thank Chief Mark McMurray of the Huntsville Police Department for allowing Officer Johnny Hollingsworth of the Huntsville Police Department to provide the crisis intervention training for our deputies, and will continue to assist us in that training. I want to thank our very own director of our academy, Director Tommy Black, who has assisted in providing the crisis intervention training and will ensure that all our deputies get the proper training in the future. The good folks from NAMI, Birmingham, who have probably been fighting for the center longer than anyone. I want to thank Susan Beatty Pierce, who has been working for a center like this since the early 90s, and who has never given up despite a lot of setbacks, and Dr. John McInnes and his wife, Tina McInnes, who have made it their passion over the past few years to improve mental health here in Jefferson County. I want to thank District Attorney Danny Carr and Bessemer District Attorney Lenise Washington, who have been supportive in our efforts to keep mental illness individuals out of the criminal justice system in Jefferson County. I want to thank Probate Judge Sherry Friday, who presides over almost all the mental health commitment here in the Jefferson County. I want to thank Senator Jabal Wagner, Senator Roger Smitterman, and the entire Jefferson County delegation, Representative Jim Carnes, Representative Neil Rafferty, Louise Alexander, Marika Coleman, Rolanda Hollis, and the entire County House delegation. The Jefferson County delegation did an excellent job for us in making sure that the State Department of Mental Health knew the importance of the center to this county. They wrote letters, made calls, and kept this issue at the forefront of their concern so many of our most vulnerable citizens. And finally, I want to thank a number of our members of our staff here at the Jefferson County Sheriff's Office who have done an excellent job behind the scenes to make sure we are prepared for the center, including Rakita Jackson, clinical counselor at the jail who works with mentally ill inmates every day, Yvonne Winston of the MAC Center, who is our grant writer and has helped us apply for additional funding for the center, Captain J.J. Reach, Lieutenant Terry Gwynn, Lieutenant George McCrullis, and a number of other people here at the jail who have helped provide statistics and jail information that was vital to the completion of the bid. The other members of the staff, of my executive staff, Felicia Kelly, Clinton Woods, and Katrina Jackson, who provided support throughout the process and helped us to stay calm while we waited out the bid process. I also want to thank a good friend of mine, Mr. Pat Lynch, who was very instrumental in getting us through this process, who navigated the whole process for us. Just want to say thank you, Pat. You helped us, and we are very appreciative of all the support we received from you. Now I'd like to turn it over to Mr. Kriegel from JBS for his remarks, and I'd like to be available for questions at the end of the conference. Thank you, everyone.
Thank you, Sheriff.
Thank you, Sheriff Petway. He said a lot of interesting things there that I agree with wholeheartedly. Primarily, this is a community effort. The individuals he named that were a part of our executive committee stakeholder group were widespread. We tried to get everyone who had an interest in this particular center coming to life to have a voice and to make a difference in our proposal so that we knew what everyone was interested in getting done with this center. And we had a great committee who came together, had an incredible bond, good chemistry, and the outcome was a successful proposal. So thank you as well to all those committee members who worked tirelessly to make sure that our proposal was funded. This is not a JBS effort, this is a community effort. And it's important that we are able to provide these much needed services to individuals in mental health and substance use crisis. Today, those individuals are pretty much faced with two choices. They can go to jail or they can go to emergency department. When they go to jail, they do get services. However, that's not the best environment for those services. Jails can be quite frantic, and jails can also be a place where they get isolated and are not interested in getting their treatment. Emergency departments also can be very chaotic. An individual in mental health or substance use crisis needs a calm environment where they are treated by mental health professionals immediately. And our emergency departments are just overwhelmed with all the other types of issues they have to face, be it gunshot victims, automobile accidents, and today COVID. So the psychiatric patients tend to be pushed to the side and get treated later. This will not push them to the side. This will put them at the forefront and get them into treatment immediately. We expect law enforcement to provide about 80% of the referrals to this crisis care center. The reason we think that is because we've seen the data. We've worked with the Sheriff's Department and the jail data, and they had over 200 people in the past 6 months every month that have come to this, that could have come to this center with a substance use issue. They had over 40 people per month in the jail who had a mental health issue that could have come to this center versus going to jail. We expect those numbers to rise now that this center comes into existence in May, not April, Sheriff. Don't push it. Don't push it. In May of 2022. If we're ready in April, we'll open in April. But it's an exciting time. It's going to bring a lot of jobs to our county, to our city. It's going to be located at 401 Beacon Parkway West, which is within the city of Birmingham limits. We have a proposal of 113.9 full-time equivalent employees. It's going to be over 150 individuals who will receive jobs in the city of Birmingham as a result of this effort. So it's a great day for the city of Birmingham. It's a great day for our population. It's a great day for this community as a whole because our law enforcement officers will be able to do what they're supposed to do, return to the streets and keep all of us safe as opposed to dealing with an issue that has them hemmed up at the emergency department. So I appreciate Sheriff Petway putting this press conference together. Look forward to answering any questions you may have, and thank you to everyone in this room for your support.
At this time, the Vice President of NAMI, Susan Beatty Pierce, will have comments.
Good morning. I'm Susan Beatty Pierce with NAMI Birmingham. I'm Vice President of Advocacy, and I am happy to be up here today and celebrate this wonderful day for the families of Jefferson County and the surrounding region that this facility will serve. This is truly a great accomplishment on many people's part. We had great leadership in Montgomery, great leadership in the local area. I tell you, I've met with Sheriff Petway the first time and we hit it off. I knew this was a man that would get this job done. When he says he's going to do something, he's going to do it. And when I know Jebo Wagner, Senator Wagner, I've known for 35 years. We started out together when NAMI Birmingham was founded in 1984 here. And it has been a long journey indeed. And without this man and these two saying yes to the families of Jefferson County that we want to fix this. We want to every citizen in Jefferson County to feel safe. We want their children to feel safe. We want their parents to feel safe. The tide is turning. This is serious times for serious people, and we are in presence of those people today. And I am so thankful for all of you being here today to launch this program. This is just the opening presentation. There is so much more to happen. This is phase one. I don't want to scare Mr. Krugo to death over here. He's got a lot on his shoulders to deal with between now and April. But Wayne Rogers, thank you, and Katrina Jackson. There's so many people here to thank. There's just not enough thank yous for all that you've done to guide us and the families into this this path to be here today. But most importantly, with the National Alliance for Mental Illness, as one of the charter family members that founded this, I have a younger brother, Richard, who was diagnosed at 19 with paranoid schizophrenia. We are a military background. When anyone in a uniform tells you to do something, you do it. And we have never had a problem with the law enforcement. And we were so lucky that when he got sick in, 81, that we had good professionals. He said yes to everything. He took his medication. And we educated ourselves about diagnosis, prognosis, the health groups out there. And he was in crisis. We heard about NAMI. Rogine Paris, the founder of NAMI Birmingham and NAMI Alabama, we were in the same training class. Families have to step up. When your person is starting recovery, you have to be there. You have to educate yourself. You have to do something. I know everyone is stressed right now with COVID, but everybody can do something. We have an army of retired public servants out there that have worked in public service all their lives, of good people that can step up and volunteer and help this project, and that is where we want to go. Please contact me. I've got the information here. Please contact me. My phone number is 205-515-6150. We need you to be on the advocacy committee. We need you to volunteer to help this project so we can guarantee you contact your elected officials and thank them personally for this becoming to fruition. And certainly Jabo and the many people, thank you for naming all of them sheriff, because that would cut my speech short. And I know I'm forgetting someone, and I apologize. But please, families, please, consumers, step up. Be strong. You can get through this too. My brother never lost his license, never lost his way of life. He works. He has an apartment. And you can have a full life too. Hope is on the way. Hope is on the way. It is here. The first step is here. And tomorrow is going to be even a better day. Thank you for being here today.
At this time, State Senator Jabo Wagner.
About 6 weeks ago, I received a telephone call from Pat Lynch about coming to a meeting down at Aldridge Gardens in Hoover. And some days it's hard to tell Pat no. So I went to the meeting about mental health. That's all I knew I was going to. So, but I went and learned a lot that day about the proposal that was coming to either Jefferson County or Tuscaloosa County. There was major opposition down in Tuscaloosa from a very, very powerful political individual that works up in Washington. But I heard the proposal, I heard how important it was. I heard why it needs to be in Jefferson County as opposed to anywhere else. So I left there wondering, what can I do? So I called Jim. I said, Jim, prepare me a letter to the Commissioner of the Department of Mental Health. I want to get every member of the Senate from Jefferson County to sign this letter. And it was a very good, strong letter. I said, I'm going to get every member from the House delegation from Jefferson County to sign a letter to the Commissioner of the Department of Mental Health. And we did. And she got the letter, and that's the last I'd heard about the project until yesterday when I heard or got a text, we got it. So that made me feel good. It makes my job very enjoyable when you see something like that come to fruition. I like to win. I like to beat the guy from Tuscaloosa. Okay. And we played a small part. This was a team effort. This was not about the Jefferson delegation, but we did our part, and I'm glad it worked out. And Jim wrote a powerful letter for me to get signed by the House and Senate members. So it's fun when you win, and I'm glad we had a small part in this huge victory. So congratulations.
Thank you.
Thank you.
Thank you, Senator. You know, they say when Jabo speaks, people listen. So we give him a lot of credit for getting this done. Before we open this up for questions, I'd like to acknowledge a couple of our elected officials who are here, who are big supporters of this initiative. Commissioner Sheila Tyson is here, and Birmingham City Councilor Mr. Clinton Woods is here. If there are any other elected officials, I don't see you, but I'd like to acknowledge you and give you the opportunity to speak if you desire. If not, we will open it up for questions.
Why was it important, and this is probably an obvious question, why was it important to get this center here in Jefferson County?
Well, Jefferson County is the hub for health services in the state of Alabama. When people think of healthcare needs and you're a resident in the state of Alabama, typically if you can't get that need met in your neighborhood, which is pretty common, you come to Birmingham. We are the hub. We have the best hospital network in the state. We have UAB, one of the finest hospitals in the country. And our citizens know this, and they migrate to Birmingham for healthcare services. And a lot of those individuals, when they come here for what would be called primary health care, many of them have mental health issues. And they get here, and they stay here. And so we want to be a central location. We're centrally located in the state. Easy to get to from east, west, north, south. It seems to be the obvious location for such an important service. So that hopefully it gives you an answer to why Birmingham.
Yeah, Jim, if I could say something, I'm Wayne Rogers, everybody, Executive Assistant to the Sheriff. If I can mention also, the region that Jim and his folks are going to cover actually stretches all the way from Sumter County on the Mississippi border to Randolph County on the Georgia border. And Birmingham, a central location for those 22 county area that we have, we thought it was very important that it be located here. From our perspective as the Sheriff's Office, we thought it was very important to be located here because we have so many people who need help at our jail. There are many people there who are there only because of an addiction crisis, because of a mental health crisis. There's really nowhere else for them to go, and this gives them a much better place to go. Jim and I went to Phoenix, Arizona with Megan and Melissa, who are in the back of the room. Several other folks went to Phoenix to see how their crisis diversion center works there, and we got to watch how it works and how so many people who would have had to go to the jail are instead brought almost immediately in front of a mental health professional and given help a lot faster. Something to understand, if someone comes to the jail, they have to be charged with a felony. And once they're charged with a felony, then the district attorney's office has to deal with them. Sometimes that can take 4, 5, 6 weeks because the DA's office is so busy before they can actually get in front of Judge Friday and have an adjudication that they have a mental health problem that they need help with. This way they don't have to wait out that 5 or 6 weeks in the jail where seriously their crisis just deepens. Being in the jail is very difficult for a person who's in a mental health crisis. It makes them worse. So this gets them into treatment and help much faster.
And Sheriff, how important is this training that you said that your officers are getting now to deal with the people that are having mental health threats?
This training is very important. Going through the academy, we were never taught on how to deal with people with mental health issues. This training put in place now will be able to help us identify individuals with mental health issues, be able to get them to a place of therapy instead of taking them to the jail. We want to make sure that they can get the treatment that they need so to get back to their families, get back to life as normal. That is why it's so important that we do this training.
I have a question for Jim. Can you explain some of the services that they will receive when they come to the facility?
Sure. So it's going to be a 24/7, 365 facility open to adults. The facility will offer, obviously, crisis care. Individuals will be broken down into really two different resources. We have 32 temporary observation beds. Those beds will have a expected length of stay of less than 23 hours. Then there will be 16 1 to 3 extended care beds. So those beds will be available to somebody who has a need for more than that 23 hours, but we expect can receive the stabilization they need in 3 days or less. We have some flexibility with that to, if it needs a 4th day, we can keep the person there as long as the demand is not overwhelming. But ideally, no one's going to be in that facility more than three days. If they need more services, and we can certainly consider admission to a psychiatric unit if that's what's required because the facility can't handle them in the crisis care unit. But our goal is to keep individuals out of the hospitals, out of the emergency departments, and out of jail. Services will be wide-ranging. Inside the facility, they're going to receive therapy. They're going to see a psychiatrist or a nurse practitioner where they will get a diagnosis done. They'll be put on a medication plan. And then we'll be trying to link those individuals to services in the community so that not only do they get the services immediately, but there's a linkage to where they can be followed, and we hopefully reduce recidivism. So these individuals, many times the biggest problem is compliance, and getting them help in immediate short term is not really the answer. We also have to provide that linkage to community providers. We have an excellent group of community providers, both on the mental health and substance use side in our area. So linkage is going to be important. We're going to employ 30+ transitional care coordinators who will work with individuals upon discharge to ensure that that linkage to care is followed through. And if it's not, they're going to help that person continue to proceed to get that care. We won't be 100% successful, but any percentage is going to be better than what we have right now. And so we will build on that, and that transitional care coordinator will play a critical role in making sure our existing community providers are also a part of this service delivery. This will not stop at the crisis care center. This will also then extend into those community providers. So it's important that we have their buy-in and their immediate access for availability for services. And we've already talked to them, and they're aware of it, and they're excited about the opportunity that this is presenting for our area.
Can I ask a question?
Yes, ma'am.
With this grant, how long will this grant last? What's the life expectancy of this grant here in Jefferson County? Because I know 1 year is not enough, 5 years is not enough to heal a person with a mental illness, because majority of the people in jail, that's what they're suffering.
Right. Well, that's a great question. We really need to thank the Alabama Legislature, Governor Ivey, and Commissioner Boswell, the Alabama Department of Mental Health, for these funding initiatives. We are the 4th one in the state. 3 other crisis care centers were opened last year, basically in May. They were awarded a year ago this time. And the funding the legislature has provided does not expect to only be for a year or 2 years. They expect this to be ongoing. As long as the state has the resources to fund the Department of Mental Health, this will be a priority funding for them. So we expect this funding to continue in perpetuity. It's $7 million a year of state money. That's a huge amount of commitment from the Alabama legislature, the governor, and the Department of Mental Health. So in total for the state, that's $28 million that they've committed in the past 12 months, essentially, to this service. And it's much needed because these individuals, again, didn't have a proper place to go. And it forced law enforcement to make a very difficult decision Do I leave this person in an unsafe environment, maybe where they're with family, they're endangering a family member, they're endangering a community person? Or do I take them to the jail where I know they'll at least be safe? Or do I go to the emergency department not knowing how long I'm going to have to stay there with that person? They'll know with this service they can come and they can be gone back out in patrol in 10 minutes and that the person's going to get the care they need. So again, it's an exciting day for us. It's a great opportunity for this community, and we're looking forward to the challenge.
After that 23 hours, what happens to the patient?
Well, typically the 23 hours, what we've seen in other locations, like Wayne said, we've been to Phoenix. We did a virtual visit with individuals from a San Antonio Crisis Care Center, and we've also been to Atlanta. And we've talked to Mobile, which is Alta Point Mental Health. We've talked to them about their center, which just opened in May. And what they find most of all is the substance use issues are the ones that are addressed in less than 23 hours. Many times a person will be gone in less than 12 hours. They needed a place to come to, maybe for lack of a better word, to dry out. Maybe to come off a high, they need to sober up a little bit. And this will provide them, again, a safe place to do that. Mental health issues are probably going to be more likely the 1 to 3 day length of stay, but the substance use issues we're hearing are going to be probably less than 23 hours. And again, the linkage to care after that is what's important. We get that person that immediate stability so they can return to the community. We bring that transition care coordinator in to help them make sure they get that appointment with that community provider, and that appointment is made and the treatment continues, because compliance with treatment will keep these individuals from returning both to law enforcement's attention, to the hospitals, and to us. And that's the goal, to give these people treatment they need and then return to a quality of life that they deserve.
Is there a limit as to how many times an individual can come back to that facility?
No, there's not a limit, but we have some ideas as to if individuals become frequent flyers, so to speak, more than 4 times in a 90-day period. We have a program of assertive community treatment, which is like a mobile mental health clinic. It has a psychiatrist, a nurse, a counselor, a case manager, a vocational specialist. We're going to then attach those individuals who are the high recidivism people to that PROACT team and let them work with them, because there's something that's not working when that individual continues to come back. The transition care coordinator is not making a connection. The linkage to the community service is not successful. So we've got that team already in place. They've been in place for over 10 years, and they're excited about the challenge they'll have to work with this population in the event we have those individuals. And we will. It's common within the mental health sector that we have individuals. Compliance is just something that maybe it's due to side effects, maybe it's due to stigma, maybe it's due to a number of reasons that they are not willing to take the medication or not willing to follow the treatment plan, that we'll have to address this with them with a PROACT type team to make sure that we can get them the care they need.
Can I follow up on one thing there?
Absolutely.
I think it's important that this be said. The policy behind this, and Megan Bork is one of the folks, Megan in the back of the room there, it's going to be a no wrong door policy. So that basically means anybody who comes here, they're going to help. That's the whole plan. Jim said, and it's true, about 80% of folks come from law enforcement, but another 10 to 15% come from emergency rooms. And then folks will be able to just walk into the center off the street. If they know they're in some sort of crisis, it's going to be near a bus line, somebody needs to go there and walk in, they can come in and walk in. And we thought that was very, very important, that anyone be able to get help, whether it's someone who's been arrested by law enforcement or someone who just feels like it's time for them to go get some help. Commissioner, if I could follow up one thing that you asked earlier too, we also as the Sheriff's Office have applied for some additional funding from the Department of Justice that we're hoping to find out within the next week or two, whether we get that funding to help with funding the center as well. So get some additional money.
I have one more question, the last question for Jen.
Sure.
What about the family members of these individuals? What about their children? Because we're seeing a lot of spillover at youth detention. I'm over youth detention. So majority of the children that come in there have mental problems, and it's because of their parents. Majority have the same thing. So what are we going to do for that category for them?
Well, hopefully those parents will be individuals that we are able to serve. Unfortunately, the Crisis Care Center does not work specifically with children. While Wayne mentioned that we are a no wrong door facility, children are not the primary criteria. We will engage children in services, but the biggest part of that will be for linkage to providers in the community. The family unit is critical. It's critical to the success of a community that the family unit stays together. JBS has a strong children's program, and we will obviously lean on them for some of the services. There's other great children's providers in the area. Children's Hospital plays an incredible role right now with individuals and children who need mental health care, and we hope to ease the burden on them a little bit. But you're right, the family unit needs to be addressed, and we're hopeful we can improve the family unit through this care and getting people who resisted care in the past or maybe didn't know where to go get care will come to us, come to our attention, and we'll serve them through the Crisis Care Center.
All right. If there are no further questions, this will conclude this news conference. We thank you all for coming. Thank you all for listening. We invite all of our guests and all the media to help yourself to some refreshments in the back. We have plenty. They're delicious. Take some with you.
All right, thanks, Steve.
Thank you.